Hi everybody, and welcome to my three-part series entitled, Why Are My Eyes So Dry? My name is Dr. Nacondas Grayson Gamble, and I'm an optometrist, and I've been practicing optometry for almost 20 years. When my female patients come into my office and they start to talk to me about their symptoms of burning, tired, watery eyes, I start to look at them as more than just eyeballs sitting in the chair. I look at them as a total person. Those symptoms are typically associated with a very specific type of dry eyes called evaporative dry eye syndrome. So as a part of my history, I will talk to my patients about any changes in medications. Are you taking new medications? Has there been a change in your work environment or your home environment? When those two questions yield a no answer, I start to talk to my female patients about changes in your hormone levels. Now, you might be wondering, well, why would changes in my hormone levels be something that we need to look at? If your eye care provider is not asking you questions about hormones and how that could potentially affect your dry eyes, you need to find a new eye doctor. Let's unpack that a little bit. So, whenever women are going through peri-menopause or menopause, the decline in estrogen levels can result in a decline in serotonin levels. Now, did you know that serotonin levels directly affect the production of tears from your lacrimal gland? A normal tear film has three main parts. There is the liquid or the watery part of the tears called the aqueous. There is the fat or lipid part of the tear film. And then the third part is like a mucousy part or mucin part that's a more oily substance. When all three of those components are in perfect harmony, then you have a normal tear film. But as estrogen levels start to decline, serotonin levels start to decline, and that's when the lacrimal gland will stop tear production. If it stops tear production, then you will start to have the symptoms of burning eyes, watery eyes, and eye fatigue. So, if your eye care provider is not talking to you about the changes of hormones and how that can potentially affect your tear film, they're missing out on some important factors that can help treat your eyes at the best levels. Now, treatment can involve over-the-counter teardrops. We can use oral and topical medications. Sometimes if the dry eye level gets bad enough, we have to look at prescribed medication. There are even new light therapies that are out and laser therapies that can help your tears. Now, there are a plethora of reasons why your eyes can become dry. Stick around and look at part 2 for more information. You can also check us out at the southeasterneyecenter.com for more information. Thanks for watching.